welcome you to Savannah Healthcare Services, and we want to have a small discussion concerning COVID-19 and pregnancy so that all of us can understand how the new virus affects pregnant mothers and what we're supposed to do to take care of our pregnant mothers so that we get the best outcomes. So with us is our gynecologist obstetrician, Dr. Murage. We want to have a discussion through this topic, so we welcome you all. Karibu Daktari.
Thank you.
And just to start us off, kindly give us an overview of the COVID-19 and what basically happens when someone contracts the virus.
Thank you very much. COVID-19 is in the SARS group of viruses, and those are the ones that affect us. I'm sure all of us have read so much about COVID, and now that it is now the new sensation worldwide. And when one gets COVID, and most of the time is through the air, as we speak, as we talk, and through even contact. The viruses affect the body organs. And they affect the body organs, they cause destruction in the tissues, and especially the blood vessels. And that is why you find we have difficulty in breathing. We have pains. We develop fever because of the toxins that this COVID brings. So it's normally a viral infection that spreads very rapidly to our bodies. And how it affects somebody depends from person to person. Some people are affected more severely, and especially people with other comorbidities, diabetes, hypertension. Pregnancy, the mothers who are pregnant also have a higher risk than the non-pregnant to develop COVID-19. That is why sometimes you find, as pregnant mothers, we want to be a little bit careful. We want to avoid lots of gatherings, lots of contact, because pregnancy sometimes reduces immunity. In fact, let me say most of the time, the immunity is slightly reduced in pregnancy, and they can be able to attract the COVID-19.
So Daktari, just to make it clear, then should someone, if they're planning to get a baby in the era and as the pandemic goes on, should they maybe postpone, or is it okay to just go on and carry their pregnancy during the season?
We are saying that life should continue in all aspects in this COVID-19, and therefore should be even our family aspirations. If you want to get a baby with this COVID-19, we should not fear and say that we're not going to get a baby because we have COVID-19. Or what we are saying is, let us protect ourselves. There is no even need to go and do an assessment of COVID-19 before you get pregnant. As long as you're following the instructions and the Ministry of Health guidelines and what us as health professionals are advising people to do. Keep your distance, put the mask, sanitation, and avoid lots of traveling and mixing and gatherings. Once you do that and you're not symptomatic, then your life should continue, and they should get babies. And then you see your doctors, and those checkups will continue. If you are symptomatic for COVID-19 and when you're pregnant, we do treat you, and your pregnancy continues just like anybody else.
For the mothers who are expectant and they do not have any underlying condition, like they do not have any pregnancy-induced hypertension, they're not non-diabetics, does COVID-19 increase risk for them getting complications during their pregnancy?
Thank you for that question. We are not seeing so much difference in pregnant mothers as to say that once you are pregnant, you stand a higher chance of getting COVID-19. In as much as you are saying the immunity is slightly reduced, we are not seeing the fact that one is pregnant. We have not seen a surge in the increase of number of cases of COVID-19 in pregnant mothers. We are not seeing that. All what we are doing is that we are protecting the mothers, we are advising them, we are reducing the number of clinic visits. We are also telling them when they come to the clinic, remember there is sanitation, remember there is the mask, remember there is washing your hands, keeping the distance. But in terms of the pregnant mothers, having that much risk we are not seeing. but we are telling the mothers to take extra care because the immunity is reduced a bit. This COVID-19 is just a new disease, so even some of the things are not well understood. And we know generally in pregnancy the immunity reduces, so there is a chance that they may get the COVID-19 because they are pregnant, but we have not seen that. And the pregnant women should not fear. All what they need to do is to exercise the precautions that we have told them. In a nutshell, let them have a mask. Let them have the minimum, the distance 1.5 and above. Let them wash their hands. Let them sanitize. Let them keep off where they are gatherings. Let them not travel so much. And when they have the symptoms, the fever, the sore throat, loss of speech, the cough, chest pain, joint pains, when they are symptomatic or when they get in close contact with the person with symptoms, let them be checked immediately for COVID-19.
In the past few months, as we have been battling the pandemic, have you seen any need for you as an obstetrician gynecologist to modify antenatal care to change, either to have to make changes that will help the clients not contract the virus while they are coming for their clinics?
Thank you. Yes, we've changed a little. What we're basically doing in the clinics is that as they enter the office, we make sure that they wash their hands with the detergent, with the required solutions, and then they have the thermal gun. If one has a high temperature, then we do isolate them and we want to ensure that they are not COVID-19. If the temperature is okay, then they go to the registration where they keep their distance. And the pens that they use, we want each pregnant mother to use their pen so that they minimize and they keep a distance from the medical staff. Once they do that, they go see the nurse, and the nurse is already at a mask, is already having a screen and already having a jacket to ensure that they protect infecting the mother with COVID-19. At the reception bay, we request that they keep distance, and that is what happens. The seats are well marked. This is where you sit. Do not sit here. And then when they come to my office, we maintain the distance. As a doctor, I'm in a jacket like I am on today, then I have the mask. If I suspect one has a cough or something, then I put the shield, all right? And then we examine them. Once we examine the patient, then I'll wash my hands with the detergents and then sanitize. I'll also request the patient to wash their hands and also sanitize. The same distance continues. The patient is on a mask, I'm on a mask, we keep the distance, and once I finish with them, they go. So we ensure that everything is done. We're able to do the baby surveillance, so we take care of the baby. We're able to do the blood pressures, the weights, the everything. And then after that, they leave my office, they go to the pharmacy, the distance is maintained, the mask is also maintained. They keep washing their hands, whatever they touch them, see, there are sanitizers all over the clinic, so they keep sanitizing. And then after that, they leave and they go to where they came from. So there are all those adjustments that we are ensuring. At every point, they are on a mask. At every point, they are keeping their distance, and they keep sanitizing. And where need be, they even wash their hands with the detergent. That is what we are doing for those antenatal mothers. And therefore, they should not fear to come to the clinic, because there is COVID-19. Or what they should ensure they do is that they follow the instructions laid down in the clinic to try and protect them.
Thank you for that, Dr. And just to make it clear, as a pregnant mother, do I have to be worried that my baby will be infected while in uterus? Does the virus get to cross the placenta barrier?
We are not seeing that as a problem. Remember, we have said this is a new disease, but as far as the new patients we have interacted with that are COVID-19, we have not had a problem with the babies. The babies are COVID-19 negative, and there should be no fear that the pregnant mother is COVID. We have done surgeries on the babies. They have gone home. They are COVID negative. We have done normal deliveries. The mothers have been positive for COVID, and they have had no problem. So For now, we can say we have not had an issue. Research is still going on. Remember, this is a new disease, but we have not had any challenge. And the mothers who turn out to be COVID-19 positive and they are pregnant, they should not have to worry. For the few babies that we have found positive for COVID-19, the pediatricians have taken over and sorted the issue and the treatment, and the babies have been okay.
Thank you for that. Then now moving on to, we have walked the journey of the antenatal care, and now it's time for delivery. Then there are those mothers that you've scheduled for normal deliveries and others for CS. Should any of them maybe test positive, how do you go about it?
For the mothers who turn positive for COVID-19 and they're in labor, for example, a COVID mother is positive for COVID positive, they come to the delivery unit. We deliver them in their own delivery room, and once they deliver, then we take them to an isolation place where they're isolated and they continue breastfeeding the baby. The delivery room is fumigated, and kept safe for the next user. So there is that delivery on their own, and the midwives and the doctors have the PPEs on. Whoever are delivering, they have full PPEs, and then the room is fumigated, and then they're taken to an isolation. We are now a special team who on PPEs, well trained for COVID protection and COVID management. They take over the management of the mother and the baby. For cesarean section, the same thing. They're kept in a special room before they go to theater. Then they are located one theater, where everybody is in full PPE gear. The cesarean section is done, and after that, they're recovered in a special place, which is later fumigated, and that theater is fumigated. Then from there, they're taken to a special isolation center to recover there, where now again they're taken care by the medical staff, well protected. So there should be no panic that I'm COVID positive, I'm in labor, I need to go off the cesarean section. It's only the precautions are well managed, all of us are all ready, and everything goes on as planned.
So the message is clear that babies who are born to mothers that have tested positive for COVID should not be separated from their mother, and breastfeeding should continue normally.
Yes.
But some of our clients might be worried that breast milk could transmit coronavirus. Could you be able to elaborate more on that?
No, the breast milk is safe, and they should not fear to breastfeed their babies. Please breastfeed your baby as required. Breast milk is safe from corona. The corona does not go to the breast milk. They should be able to breastfeed as usual.
And then after delivery, these mothers, are they supposed to come back to review in a shorter time than mothers who are not positive, or what happens? When do you expect them to come back for review post-delivery? Normally
we review the mothers, even the negative ones, after 2 weeks. So for the ones that are positive for COVID-19, once they go to the isolation center, and then after 14 days, 10 to 14 days, the COVID is repeated. Most of the time it is negative. And once it is negative, then those mothers can now join to the clinic. There is no hurry to see them earlier. There is no emergency to see them earlier. We just go as planned in the postnatal clinics as planned. The only thing is that after 10 to 14 days, they are checked and the COVID test is done, just to ensure that they are negative. Then they can join into the clinic. If they have to be reviewed and they're still positive, then they are seen in the special isolation centers. Otherwise, after 10 to 14 days, most of them are turning negative, and now they can be able to join the rest in the normal routine postnatal program.
Thank you so much for that, Dr. It was a good pointer into matters surrounding COVID-19 and pregnancy. As we finalize, we just request you to give our clients and our mothers a take-home message.
Thank you so much. All what I can say is that let's not stigmatize pregnant mothers who are COVID positive. There is something programmed. We have programmed good care for them, and they should not fear. The ones that are young and want to get babies, let them continue having their babies as planned. COVID-19 now is on a downward trend. I know we should be careful also for a second wave, just like other countries that were ahead of us have gotten second waves. So we continue taking the precautions. Let us continue putting on our mask, keeping the distance, sanitizing, washing our hands, not staying in congested places. Let's avoid traveling a lot. Once we take those precautions, then pregnancy and COVID should not be an issue, and you should be able to continue with our family life as usual. Thank you very much.